Manager within the Division of Behavioral Health and Recovery at the Washington State Healthcare Authority. Thank you so much for joining today as we start off 2026 with our January meeting. We have our usual slew of reminders, and then we'll do a quick roll call, and then we'll jump right into the agenda. We actually have a slightly updated agenda that we'll try to put into the chat for everyone to access, but we'll also present it on the screen. Before going into all of that, just some reminders that this meeting is being recorded and live streamed on TVW. All meeting materials, including the recording, are available on our webpage on the Healthcare Authority website. Please be mindful about information being shared during this meeting, as all of the recording, the materials, and all of the other content related to these meetings is subject to public disclosure. And so please do not disclose any private or confidential information. Next slide, please. The ongoing reminders about language and terminology so that we can be respectful of people's experiences. Just please be thoughtful about the language that you're using to describe either substance use disorder or drug use, ongoing substance use. We have a resource that we've shared a couple of times and just want to continue to be mindful about that. And if somebody does use language that would, that kind of reinforces some of the stigma around substance use and substance use disorder, just please correct them in a way where we can learn together, as well as, one second.
Oh, that's a great connection.
Yeah, they're idiots.
As also a reminder to please mute yourself in the meeting. I'm not sure where that came from. Okay, next slide, please. And then also guidelines for public feedback. We will usually provide time at the beginning of the meeting as well as the end of the meeting, as well as throughout the meeting for public feedback. Just comments as brief as you can. We'll try to limit it to around 3 minutes. And then also, as always, we can accept feedback through email at the HCA esb5476@hca.wa.gov. Okay, before we get into the agenda, just want to do a quick roll call just to see who we have here participating from the committee. So we'll go through that real quick and then share the updated agenda. First I have here is Senator Moncadingra. Senator John Braun. Representative Lauren Davis.
Happy New Year.
Oh, Happy New Year. Representative Brian Burnett.
I'm here as well.
Great, thanks so much. And Caleb Banta Green.
Good morning. Glad to be here. I'm going to have to drop off a bit early, just FYI.
All right, thanks for letting us know. Don Julian Saucier.
Good morning.
Good morning. And Sean Meyer. Alexi Orr. Amber Cope. Randy Flood.
Present, and I'm also going to have to drop off early at about 10 o'clock.
Okay. Thank you, Brandy. Stormy Howell. Chad Enright. And John Hayden. Vicki Lewis. Sherry Condelario.
Good morning.
Hey, good morning, Sherry. Happy New Year.
Happy New Year.
James Tillett. Christine Lynch,
Good morning.
morning. Sarah Gillard, Danelle Tanksley, Malika Lamont, Addie Adwell,
Good morning.
morning, and Hunter McKim. Representative Levitt, and Representative Manjarez. Okay, so I count 8. So it looks like we have 8 committee members present. So, after the holidays and everything, a couple of weeks with some holiday time and beginning of the year and legislative session right around the corner. Not 100% surprised. Just being mindful about. Rachel, can you present the agenda? We did have some time slated at 10 later on in the agenda. You can scroll down for 2026 planning and priority setting. And if we have 2 of the 8 committee members dropping off around 10 or early, that leaves 6, which is about a fourth of the committee. So I'm just wondering how the members of the committee want to move forward with that. We have obviously other agenda items planned as well. So just kind of opening it up to the committee members that are present for kind of input about that time on the agenda and how we want to kind of address the committee shortfall. And then just for some more context around that agenda item, we started to talk about this last year.
Oh, hey.
And really talking about how we're going to spend this last 11 months of the committee before it sunsets December of 2026, how we're going to prioritize that time, what sort of topics we want to bring to the committee for discussion. So a pretty important piece for at least the healthcare authority's perspective so that we can kind of plan the rest of the meetings for this year and make sure that we're bringing information that's relevant and helpful and also making time for conversations that are relevant and helpful. And so I just worry about doing that with only 6 committee members present. And I thought I saw a hand. Sorry.
Julian had his hand up. But put it down, and then Caleb also put it. Can we vote virtually later this week?
I mean, so let me start with Caleb's comment on and thanks. I'll just go to the chat because it looks like that's where we're receiving some of the input. We tried doing that with the Menti a couple of times, and we don't really get a lot of active feedback when we try to do things virtually and offline. And that's not a critique at all. I know everyone's incredibly busy. I think that's just the reality. When we try to kind of get feedback or input through kind of offline, through whether it's through the SharePoint site or a Menti survey or something like that, it just doesn't seem like it's the best method to get input from the committee. And then, yeah, it looks like Sherry supports that proposal as well. And then Julian, Julian, I agree. I think hearing from more of the committee is really important. So thanks for that input. we can always do an ad hoc meeting. We can try to schedule just a shorter meeting, 30 minutes, sometime this month. I know we're going to lose a lot of our legislators, our representatives from the House and Senate. We're probably not going to be able to get their time with an ad hoc meeting. Just because we do have some presentations slated, think about it, and then we'll try to, and we can talk about it more once we get to that agenda item number 5, and maybe we can flip around agenda item 4 and 5 and do the 2026 planning and priority setting before the R&P data work group progress and challenges, and that way we can try to catch some of you before you have to drop off at 10. Noting the time now, sorry, 9:12. Real quick, I just want to do a couple of quick HCA announcements. Sorry for going off topic there. We received some really, really good news at the end of the year related to the Rural Health Transformation Program. As a reminder, we talked about this a couple of times in previous meetings. This was funding that came out of HR 1, the federal legislation. It's a grant program administered through the Center for Medicaid Services, and Washington State applied for that grant along with a number of other states across, I think, every state. And the awards were announced. Washington State received $181 million and a little bit more for federal fiscal year 26. And this grant is slated to run from 2026 to 2030. I put a link in the chat from the Center for Medicaid Services where you can go to more information and context about the grant program. And then also our public-facing webpage from the Healthcare Authority, where we'll continue to provide updated information about implementation of that funding. Currently, our multiple divisions at the Healthcare Authority are reviewing the grant award notice as well as the terms and conditions and trying to make sure that we understand what those terms and conditions are. And so more to come with that, but it felt like such great news. I just wanted to make sure and share that with the committee. From what I understand, the original application included a number of behavioral health components related to rural health and rural health care. And so wanted to start off 2026 with some really good news and make sure that everyone was aware of that coming through. As another piece of information and updates, the governor's budget supplemental 2026 budget proposal was submitted. You can go to the OFM website, or not submitted, but released. And that information can be found on the Office of Financial Management's website. I'm going to put the highlights document into the chat, and then there's other documents as well that you can access through that link that kind of touch on some of the high-level areas that the governor's office is proposing to either cut funding, increase funding, and in a lot of places kind of move funding around to try to free up some of the general fund state dollars that are currently appropriated. And so wanted to make sure that the committee had that information as well. I haven't had a chance to do a really full and in-depth dive around the governor's budget, but just a reminder, this is a starting point for the legislative session. The governor releases the proposed supplemental budget, and then obviously once the legislative session starts, both houses of the legislature will take a look at that and also put forth their own proposals, and it will evolve and it will change, and then hopefully we will have a pretty close to final supplemental budget around March of 2026. And so obviously once there's more information, we can bring back some of that concrete information to the committee so that you're aware of any changes around behavioral health investments for state fiscal year 26 as well as state fiscal year 27. With that, I'm going to go ahead and transition to our first agenda item, where we invited some colleagues at the Healthcare Authority within the Division of Behavioral Health and Recovery, Diana Cockrell and Hannah Trappigan, to talk about Washington Thriving. I felt like, well, I didn't, we felt like this was really important context and information to make sure that the committee was aware of around the work that the Children, Youth Behavioral Health Work Group has been doing. And they have really hit a huge milestone with releasing the Washington Thriving Plan. And they're here to just talk about that strategic plan, with the, share information with the committee, take any questions. And so wanted to start off the meeting with sharing some of those updates. And so Diana and Hannah, are you there?
Present and accounted for.
Oh, wonderful. I didn't do you justice in actually doing a full introduction. So please introduce yourselves and thank you so much for being here and thank you for sharing this great work.
Thank you for the invitation. Really grateful to have the chance to share this with all of you. I am going to do most of the talking today. Hannah is recovering from something more than a frog in the throat. So somebody ask her a question at some point because it could be fun to hear her voice. My name is Diana Cockrell. I work at a Healthcare Authority in the Division of Behavioral Health and Recovery and serve as the section manager for prenatal through age 25 behavioral health. Thank you for having us here to share this effort. As Tony said, it's the Washington Strategic Planning Effort for Prenatal through age 25 Behavioral Health called Washington Thriving. It is actually a subgroup of the Children, Youth Behavioral Health Work Group, which is a legislatively assigned work group for young people. And it's been a subgroup there for the last 3 years to produce this report. Hannah Traphagen is with us today. She is one of the maestros of the development team with us on this project, and acknowledging those who aren't here today who also were part of that effort. My co-chair in this effort, Representative Callan, the Behavioral Health Catalyst Partners. You may know Dana and Riley if you've been to any of the meetings. And most importantly, our incredible advisory group. I believe Hannah's dropping a link so you can see who our advisors were on this work as it went. So I think let's share the full value agreement. We brought together folks with lived and living experience and frontline experience attempting to deliver behavioral health along with system partners with the intention of centering the voices of those who are receiving or attempting to receive services and delivering and attempting to deliver services in behavioral health for this lifespan. And knowing that in that setting, there are multiple perspectives and points of view, and every single one of them is important and valuable, and wanting to center what we built on folks who are experiencing the system, decided as an advisory group to come up with how we would do that. So this full value agreement is what that group came up with, and I think likely a recipe for what's coming as far as implementing across the next decade or so of this work. So with that, Hannah and I are going to switch who's sharing what. And if you're okay with it, I would like to just walk you through the strategic plan as it's set up on the website. The link will be in chat so you can go there yourself and play around. Because it is here, and our hope is that as people become familiar with this work and or that it's been published, there's interest on your part in either sharing feedback and or sharing with networks. Because for implementation, it's going to be really important to keep that focus building from the voices of lived and living experience and from the folks who are attempting to deliver services frontline at this point in time to know if we're getting it right or not. So I want to empower all of us with the tools to find out what's there. So if you go to washingtonthriving.org, you'll see a link for the strategic plan here. You'll see a link for the strategic plan here. When you go into that piece, it's its own universe. So this is like a high level look of the strategic plan. So it's an easy way to look at it. We highlighted the needs, the vision that advisory group identified as what this effort needs to do across our system, the goals, the foundational dimensions. So recognizing there's ways to think about this. One is strengthening the infrastructure. So what's in this is the governance, recognizing that there are many folks at the state level with many layers of things that are being built and done that may or may not be synced up, leveraging the best of each other. So the strength and infrastructure is one of the first efforts. Expanding offerings, think of that section or dimension as the from prenatal through age 25 and the full prevention, mental health promotion, treatment, care, crisis, recovery supports, ongoing well-being support, that whole continuum for that whole lifespan. And then the values in action, that dimension is intended and has to, as you read through it, you'll see, be infused into everything that happens in the first two dimensions. This is the trauma-informed, equity-centered, paying attention to what the people who are experiencing the system and or trying to deliver services in the system are experiencing, and really listening to that as center. Long-term roadmap, this is going to take a long time, and as it reveals itself with what opportunities are available, the hope is that with one, the analogy that I've used in the past is a plane flying from Seattle to Minneapolis is pointing at Minneapolis approximately 7 to 10% of the time, but because it knows where it's going, it gets there the majority of the time. This is our hope with the strategic plan and the roadmap. If we're all moving towards the same area, the likelihood of getting there is greatly increased. So someone hears how giant all of this is and thinks, sure, okay, but where do you start? So here's where we go to first initiatives down here towards the bottom. And some of the first initiatives in the first couple of years will really be about governance. So setting up structure in the state so that there's accountability and responsibility and recognition of the need for a system of care with capital S and capital C. I'm guessing, Hannah, this is a surprise, but if you have a link for what we mean when we say capital system of care, you want to put that in chat, that would be great. You'll see. I don't want to spend time unless people want to know more about that piece. So the other piece is outcomes monitoring. Right now, we can tell by program sometimes how things are going, but systemically, we don't have a way to see how we're doing. If what we're purchasing, if the policies that we're making are making a difference for people or not. So that is outcomes monitoring is a big first focus in this direction, a recommendation of the strategic plan. The thing that with Washington thriving is really important that happens is there's the data stuff, and that the data be transparent, shared, open to anybody who is curious and interested, but also that it is vetted and run through folks with lived and living experience and who are working on delivering services in the system, so that there's attunement to whether or not what our data says is actually what people are experiencing or not. So those two things together are the outcomes monitoring vision. And then funding coordination. So this is looking at all of the federal and state and the broad group of funding streams that are coming in different places to see how it's coordinating, if we're leveraging the best, if we're duplicating, etc.
Yeah, let me get out of it.
So then for the service continuum for steps, some of this was as the process of developing Washington Thriving over the last 3 years happened, there have been areas in the system that are identified and known as high need. Right now, we need to do something as fast as we can. And the ones that also had potential for philanthropic support rose to the top, recognizing the budget conditions that we're in right now. It was a way to create some movement in areas of need, or potential movement in areas of need, while we wait to see how things roll out for structure with Washington Thriving, and as funding comes or doesn't come based on the budget that we're looking at. So one of those areas is perinatal well-being, student behavioral health, looking at how schools can partner in supporting schools, partnering to support young people and educators. And then in the treatment services expansion, that's the spaces around recognizing we have young people that are stuck in inappropriate care settings, either waiting for an appropriate setting and or struggling to find where that exists or create it. So with that, I'm going to stop sharing. I think you all have the link. I can pull it back up as needed. And then, Hannah, I think, thank you for the system of care information, Hannah. I'll pause for questions. We had a question framed that might show up in chat, but first, are there any questions, thoughts, concerns, feedback that you'd like us to hear?
I'll jump in real quick. Thank you so much, Diana and Hannah. And then just as a reminder, I mean, like there was a long process here, and I think we shared updates along the way with the committee. I remember whenever there was a solicitation for feedback, or when Washington Thriving sent out like some, I think, draft strategic plans and asked for public feedback, asked for community feedback, we did get those to the committee and shared those, and just to make sure that you were aware that this was happening. So hopefully this isn't 100% new information, but something that brings some sort of memory about past communication that we've sent out to the committee. I didn't want it to be 100% new. The one question I had was, and I know that there's been a lot of work around expanding education, awareness, access to medications for opioid use disorder for under age 18 for youth. I forget the age range where it's scientifically indicated, medically indicated. Was within that expanding the treatment context, expanding treatment alternatives and options, was that something that was included within the strategic plan?
Yes, I think it's, I don't know if you'll find it specifically, but recognition of the constellation of SUD co-occurring care that's needed for young people, and paying attention to that system and being intentional is part of that service treatment expansions. Let's see. One of the dimensions around, I have to find the word, so I give you the expand offerings. In that lane of work, it will fit there. Hannah, are you able to talk? And do you happen to remember if there's anything around MOUD for youth specifically mentioned?
It's a wonderful question. I apologize for my voice. As Diana said, I'm getting over some mean virus, but I don't off the top of my head know specifically the answer to that question, but what I will say is that throughout the process, we heard from people all across the system, from providers, people on the agency side, people with lived and living experience, and did our very best to create a strategic plan that was not prescriptive and was not explicit to say we need to have this type of program for this age range for this thing specifically. Instead, the strategy in this plan was to create the buckets in which everything can fit, so that there is space for the MOUD work with young people, and there is space for all of the very specific niche areas of behavioral health that our state is working in, without saying explicitly what those things are, in an attempt to not exclude anything as the system continues to evolve and grow and change, as we know these things do. So I just want to say that while I don't remember off the top of my head if that's explicitly mentioned in the strategic plan document itself, I know that it was discussed, and I know that it falls into many of the buckets that are housed in the strategic plan work, so that it has places it can fit and grow and morph and become a part of this system of care as we move into implementation. And I hope that helps in some way answer that question without being totally on the nose there.
No, that's really helpful. And for what it's worth, you sound great. So I think you're
Oh,
making
thank
a
you.
great recovery. And no, I think that makes a lot of sense. And I appreciate that additional context.
Any more questions for Diana and Hannah?
And then just
Okay.
in case anybody on the committee didn't know, Hannah did put in the chat a prompt. What other ways can we support awareness and inclusion of this work with those who might not be connected yet? And so, great question. And I wonder, is there, how best would somebody reach out, you know, with kind of feedback if they don't, if something comes to them at a later time, like, you know, when driving home or going out to lunch and they're thinking about the awesome information from today's meeting and they want to connect with somebody, is there a inbox or a specific point of contact that we can point people to?
I just put it in the chat. You're always welcome to reach out to myself or Diana directly, but we do have an inbox where I've shared the link to in the chat that goes to the project team. I'll also send a couple of links. We do have a community toolkit online that I'll give Diana a second to talk about if she would like, but some other links to subscribe to the newsletter as well if you'd like to stay up to date with things as we learn more and as things progress.
Thank you, Hannah. I'm glad you brought that community toolkit up. We, as part of the effort in partnership with Behavioral Health Catalyst, have been able to work with a comms firm who helped develop a toolkit so that anyone who learns about any of this and you're interested in it and want to share with your networks or think about how to share the communication, there's the toolkit. Yeah, thank you.
Well,
Thanks
again,
for having us.
yep, thank you so much. Thanks for being here and thanks for sharing this great work and the information. And we'll make sure and include those in the notes as well that we'll send out, we'll put on the website. And Happy New Year to you both. And I look forward to seeing how this work evolves. Oh, Patty.
Happy New Year. Thank you.
Oh, I was just wondering if somebody could put contact information in the chat for somebody to get a hold of around this work, if that's possible.
Yep, Addie, I think it's the info@washingtonthriving.org.
Thank you.
Awesome. All right, thanks so much, Diana and Hannah. And Blake, I'll pass it to you to help us stay on agenda and move to the next topic.
All right, looks like we are on time and we're right close to it. So Sean O'Neill is next with our 2026 legislative session preview. Sean, you there?
I am here.
right,
Can everyone
thank
hear me?
Yes.
I am likewise recovering from cold, so if you can't hear me, please just interrupt and tell me to speak louder or something, and I will do my best. But yeah, so the 2026 legislative preview, and we are just 1 week out from the first day of legislative session. And so just a high-level overview, a reminder that this is a 60-day short session. So what that usually means is that we are dealing with supplemental changes to the state budget, reacting to budgetary and policy issues that didn't quite get addressed, or implementation challenges, or so on and so forth for this session. And we did see a governor's supplemental budget come out over the holiday break. I think it was on the 23rd, and not a ton of earth-shattering things in the governor's 2026 supplemental budget. A few things that we were kind of anticipating. I'd be disingenuous to not acknowledge that it does include an administrative reduction that we're still analyzing for the agency. And it also has some reductions to some programs, like probably the one that's most closely associated with this group is 10% reduction to the funding for Recovery Navigator. There's also a number of fund swaps where things are moved from general fund state to the opioid settlement account. And I think that what you're seeing there is just the real attempt to not cut services, but also recognize the funding challenges and the fiscal challenges that the state is experiencing right now, and likely will experience for probably the next couple of budgets, is what I would anticipate. And so yeah, there is that. There's also good news in the budget, like CCBHCs get funded for another year, as we are trying to demonstrate the effectiveness of that model. And then there's spending authority for the Rural Health Transformation Project. We did get approval on that, and we got approval at a level that from the federal government. I should clarify that we got approval at a level a bit higher than most people at the agency was anticipating or were anticipating. I think we were approved at about $181 million for the Rural Health Transformation Project for 2026. So that was good news. And then also just looking at the agency request legislation for the year, we've been approved for one agency request bill, and that agency request bill right now is a small bill that allows us to spend part of the PALS assessment on the administrative contract rather than using general fund state. So a small little bill there. We're also waiting for approval on one last bill regarding privacy in the Healthy Youth Surveys. So reflecting what we think is a real, supplemental year in every aspect. The agency request legislation is down this year as well, as far as volume is concerned. I think that just overall, The volume of bills that we're looking at in pre-filed bills is a bit smaller this year as well. I just refreshed my memory on what's been coming through so far in the last couple weeks, and there's not a whole lot of earth-shattering bills that are coming through that would be of super high interest, I don't think, in this group. And so yeah, are there any questions? I think we're still just kind of in a wait and see mode to see what is going to transpire from members of the legislature as we move into session.
Thanks so much, Sean. Just sorry, what were we going to say? Go ahead.
Oh no, I was just going to say, any questions at all?
Just going to flag for the committee while they think about any questions, and then we can also open it up for any public questions as well. You know, as Sean mentioned, the governor's proposed supplemental budget does include a 10% reduction to the Recovery Navigator program. Just going back a year ago, the governor's proposed supplemental budget, it was a 20% reduction, and then as we all remember, the legislature landed on a 10% reduction as part of the biennial budget. And so now we're at a point where the governor's proposal includes another 10% reduction, probably to meet the original proposal that came a year ago.
Yeah, it is. It's definitely a lower volume start so far, and as I think in looking at the budget, you know, anticipating that the budget could have been a pretty drastic budget for a supplemental year, it is not as dramatic as what we were thinking on most fronts, and so. So 10% reduction. So I see the question there around that. If it were passed, it would go into effect on July 1.
And then just for the record, thanks Representative Davis for correcting me. It was a 20% statewide R&P reduction that passed as part of the biennial budget.
Admin reduction, I don't know what the percentage is, but I think it's somewhere around $4 million across the agency or whatever, which may not sound like a lot, but 4 million, that either equates to a lot of contracts or a lot of jobs. And so it like I said, it definitely is someplace that could be a lot worse, but it is one of those things that, like, it is difficult to implement, but given where we are in the fiscal realm for the state, it is definitely not as bad as that could be. Any other questions as we move?
Questions for Sean? Sean, I don't see any. So thank you so much for your time here today. Tony,
absolutely.
I put a question in the chat. I put a question in the chat, Blake.
Okay.
Is it 4 million? Sorry, it's Brandy from Reach. Is it 4 million reduction on top of the 10% that's already coming to?
So that's not Recovery Navigator, the 4 million that I mentioned, and I'll have to go back and look at what the actual number is. That's administrative reduction across the general fund state administrative dollars that runs the agency. So it's just an across the board admin reduction for the agency. Great question.
Anything else? All right. Thank you, Sean.
Yeah, of course.
Appreciate your time. All right, next up, Tony, did you want to make changes to the agenda we have? We are at 9:46, a little ahead of schedule. Do we want to go with Brianna?
Yeah, thanks so
Or-
much. Rachel, can you pull up the agenda?
Want to go with Brianna or some planning activities here?
And let's pull up the agenda just so everyone has something to look at while we discuss the next item. Thank you, Brianna, for your ongoing flexibility. I think the decision is whether or not we want to move up the 2026 planning and priority setting agenda item to now instead of having it be the last item of the day. I think given, at least knowing that we might have some committee members dropping off at 10, that makes a lot of sense. The last time I looked at our attendance list, it looks like we have around 10 committee members present, so a little less than half of the committee. So we can at least go into the overview that Michelle has prepared and start the conversation, and then discuss whether or not, and basically go from there to decide whether or not we want to include this on the February meeting agenda, or if you want to solicit input and feedback through email or some other means, or if we feel like there's been enough conversation today for the Healthcare Authority to have some sort of information and informed feedback from the committee to help us plan for the 2026 meetings. And so, yeah, let's go ahead and jump to agenda item number 5, 2026 planning and priority setting, and we'll see how much we can get through with the committee members that we have here present now. And then Brianna, thanks. We'll get to the R&P data work group progress and challenges shortly after.
Okay, thanks, Tony. So we're going to start with a quick review of the results from the SURSAC engagement survey that we had via Menti a few months ago. And I'll move through these pretty quickly because everyone should have a copy that was emailed out with the agenda earlier, and these will be also posted to the SURSAC website if you want to take a look later as well. So the first question was, how can HCA better engage SURSAC in monitoring the SURS plan? So it looks like newsletters and emails reporting on ongoing efforts are helpful, including which part of the plan the update is about, relates to opportunities to provide written commentary. So our SharePoint site could be helpful for that. Shifting the meeting structure to facilitate more discussion, including use of small groups. Having a data dashboard to share information for upcoming meetings ahead of time. Giving time for members to come prepared with questions and comments. Having a quarterly meeting to discuss any outstanding, not yet implemented elements of the plan. Weekly updates to members during session to bring attention to any legislation related to the plan. Again, updates over email, updates at meetings, providing copies of any updates or amendments for SURSAC to review prior to submission to the governor's office. Data, tables, and agendas and guest speaker slides received prior to meetings. So I will absolutely be making that a higher priority, giving you meeting materials as soon as possible prior to the meeting so you have chances to review that and prepare accordingly for the meeting. Second question was, which parts of the plan are you most interested in monitoring and discussing? The asterisk indicates that a second or third person echoed that in the responses. So housing options along the continuum of use and recovery, health engagement hubs, evidence-based diversion programs such as Recovery Navigator program, items related to SUD treatment, initial SUD engagement, and all aspects of the plan. So these were various responses from folks. Next question was, what do you see as SURSAC's role in monitoring unfunded or not implemented parts of the plan? So want to have a session that outlines which parts are fully versus partially versus not at all funded, with possible actions that the committee could take. And if the items are not going to be funded or implemented, there is no relevance in the committee monitoring those items. That was another response. SURSAC could submit a legislative agenda to HCA for legislative action or support for those items. SURSAC should stay informed if the legislature chooses to take action on those pending items. SURSAC should advocate for full implementation and remind people who say, quote, the plan isn't working, to the fact that the plan is not fully implemented. SURSAC should be reminded of the aspects of the plan that have not or cannot be implemented, especially for the new members. And then there was a question to add anything else. Responses included, a lot of good has come from this committee. We need to realize change is slow. New committee members should be educated on the work that SURSAC has already done, especially around diversion and other priorities. The Recovery Navigator program works, and we should be developing policy responses based on evidence, ethics, and resources. And I'm sorry, there was a typo there. So this slide is not from the survey. These are some initial ideas for collaboration and engagement that HCA has come up with that we want to open a bit for feedback from you all. So cameras on during meetings for SURSAC members, just to improve engagement and to also know who among the attendees are committee members. Sending delegates if you're unable to attend so that a voice from the area that you represent is still present at the committee. Committee members sending questions for presenters. So this ties into getting the agendas and the materials ahead of time so you can see what guests there are and providing questions for them ahead of the meeting. Sending presentation slides to committee members at least 1 week before meeting. And then sharing the agenda planning document via SharePoint for committee input throughout the year. So I'm just going to keep that slide up for a few minutes for any additional ideas that you all may have for collaboration and engagement so that we can add your responses now to what was received from the Mentee survey.
And then adding also any kind of comments or feedback on those kind of proposals that we wanted to have a starting point, like something to at least be able to kind of feed off of, or at least starting the conversation. We just want to make sure that this last year is collaborative and that we are creating time and space for meaningful, helpful conversations about the plan, about where the plan is headed, and successes, challenges with implementing the plan in alignment with RCW. And so I know we have around 10 of the committee members here, and so just please unmute or use the chat if you're unable to unmute due to where you currently are. And then we can also solicit some input offline as well as a follow-up to this meeting. I think really where we want to at least try to nail down are the potential topics for conversations at future meetings. The February meetings right around the corner, and then we have March and April, and then it's just ongoing from there. And so the sooner that we have kind of some input from the committee, the better that we can do in planning and organizing and trying to have prepared presenters, guests, or other content that is meaningful and helpful to the committee. And so why don't we jump to the next slide, Michelle?
So I'm not going to read through these. These are just ideas for agenda items during this year. The ones that are bolded are ones that were identified at the beginning of last year that we didn't have time to insert into agendas in 2025. So we just wanted to highlight those. But I think now is the time to get direct input from each committee member to answer the question, what topics do you want SURSAC to address in 2026? And those do not have to be limited to what you see on the slide here. These are just some ideas to get ideas rolling, but it could be anything you want to share.
Yeah, and then again, I mean, some of the ones that aren't bolded, and like Michelle said, we don't need to go through each one, but they are things that have come up. Like we take notes, we keep notes, we send those notes out. We also just make internal notes and have ongoing internal conversations. And so, things like updates from the reentry waiver, like knowing for the committee to know where we are with implementing the reentry waiver under Medicaid Transformation Project 2.0. Really important context for considering how the Recovery Navigator program and other programs are being implemented within the confines of the plan. So even though the reentry waiver isn't explicitly called out within the Substance Use Recovery Services Plan, it is a statewide initiative that is incredibly impactful and helpful in terms of a across the spectrum expansion of services for the community behavioral health system. And so it's important to know what's happening with that while we're discussing implementing the plan, because it's contextual information that informs ongoing plan implementation. And so same thing with the Washington Thriving Strategic Plan overview that we just had, like knowing what has been identified for like the lifespan continuum from prenatal through 25 in Washington State is incredibly important context in relation to the plan and ongoing implementation of the plan as well. And so a couple of these other ones, Washington Recovery Alliance did community listening sessions. And so, we have talked with them about having them come and kind of share some of the outcomes from those community listening sessions, as well as collaboration with other similar groups, councils, work groups, committees like the Behavioral Health Advisory Council. And we talked previously, I think a year ago, or maybe a little over a year ago about the state opioid and overdose response plan and the listening sessions they have and the work that's happening as part of those ongoing efforts for our state opioid and overdose response. Okay, so I rambled on enough. It looks like there's some thank you, Addie, go ahead.
Yeah.
Sorry, Tony. I'm just wondering, what is Proviso 87 report?
Yes, yeah, the Proviso 87 report. Sean, I don't know if you have any of your notes. I'm going to try to, from my memory, it is a proviso from a couple of years ago in either the supplemental budget or biannual budget, almost 3 or 4 years ago at this point. But it has to do with RDA was tasked with looking at like the full community behavioral health system, including crisis, including beds, including bed capacity. And they've developed a report kind of summarizing mental health, substance use, crisis across the continuum, and availability of services region to region and those sort of things. And so that was, I think we talked about it when we had RDA come and talk about the current state assessment and SUD prevalence and some of the SUD specific efforts and outcomes that RDA has analyzed as part of that work that Katie Bittinger came and shared. And so that's just kind of additional context related to that. And I'm not sure if any of my HCA colleagues on the call have more or better or more in-depth context about Proviso 87, but I know it's something that we've talked about at the state level for a while. So I should have a better memory at this point. I blame it on the new year. Yeah, Addie.
Thanks, Tony. One question I have is, what work product is this committee responsible for producing this year during 2026? I think that would help me prioritize which topics to address if I understood what our charge was for this year a little bit better.
Great question. And we could have led with that as well. So the last final report on implementation of the Substance Use Recovery Services Plan is due December 1st of 2026. And so that's really the last work product where we are going to want to have the committee's feedback and input to help inform that implementation report, progress report, and where there have been continued to be challenges or successes related to that plan. And so that's really the last opportunity, at least as currently legislatively authorized through the RCW, for the committee to help inform. There's also you have to think back a year now, maybe a little over a year, we had Yumiko Aratani come and talk about the SUD prevalence reports, the comprehensive assessments. That was another legislative report that came out of the 2023 special session, where it is a comprehensive assessment of the availability of SUD resources, as well as like law enforcement accessing resources and things like that. Maybe somebody can grab that RCW and put it in the chat. But it's these comprehensive SUD reports that are due July 1st of this year as well. And I think within that RCW, it does indicate that the healthcare authority is to consult with the committee on those reports as well. And so a couple of legislative reports where we would have the opportunity to include committee feedback and committee input. Yeah, I don't know. So let's
All right.
pause. Any? And
We
just
losing
want
audio?
to. No, I don't think so.
Okay.
I mean, I don't know, unless somebody else is.
All right. Next steps on this, Tony?
Well, it'd be helpful to get some more feedback from the committee, or thoughts from the committee. Addie, thank you so much for those helpful, clarifying, contextual questions. I did notice from a non-committee member in the chat, they proposed, what if SURSAC transitioned to a community-chaired committee to help reduce HCA's workload? This was discussed briefly before, but did in advance. While not a committee member, I've attended all SURSAC meetings since day one. So, Shelley, thanks for that feedback. I think I would say to that the RCW directs the Healthcare Authority Director to appoint a chair. And so at this point, and given that we have 11 meetings left in the year, we'll probably maintain this current format, but definitely open, if any of the committee members have any thoughts about how we can continue to include or provide opportunities for community feedback and community engagement, definitely welcome that sort of input. Okay, so at this point, next steps, I think what we'll do is we sent this presentation out to the committee, what was it, last week?
Mm-hmm. The agenda, yeah.
So we will follow up with email communication to the committee members and try to get it to all the committee members. And then we will propose some next steps that might include either an ad hoc meeting sometime in January, or providing feedback through email. We can do some sort of online poll, but really want to at least, and we can provide some additional clarification based on Addie's really good questions today around those two opportunities for the committee to provide input, where we can include that input with the legislative reports that we have to submit to the legislature, the governor's office, and OFM. And so, yeah, we can definitely follow up offline and start the conversation there. And then, if anything, bring this back to the beginning of the February meeting for ongoing updates and try to get some more input at that time as well. I noticed that Christine Lynch put in the chat, so just want to make sure it's read for the record. Christine indicated, based on what I am hearing on the charge for 2026, would it make sense for the committee to receive a document that outlines what elements have been completed in the plan and what elements remain outstanding? That way we can provide input and feedback on the challenges and obstacles associated with completing the balance of the plan elements to inform the required reports to the legislature. I think that sounds very doable. We've done that to some extent on the annual progress reports. There's usually like one of the last sections of those SURS plan progress reports includes kind of like an update on which aspects of the plan have not received any momentum, either policy or funding momentum. But we can definitely put that together before the next meeting and send it out to the committee and then just clearly outline which elements of the original plan submitted, I don't know how many years ago, have been implemented or funded to some extent, and what that funding or implementation looks like, and then also which ones just haven't been realized or operationalized, implemented, funded, or if there's still some policy aspects out there that need to be addressed. So, Christine, just I want to try to wrap this up a little more tightly, and so there's not as much kind of ambiguity going forward. We do have other committee members still present here, maybe with not in a formal vote because we don't have a quorum, but maybe some informal thumbs up or raising of hands from committee members. If that plan sounds good, then that will at least give us some like informed direction from the committee. Seeing some hands raised. Seeing Julian. Good to see you.
Christine, got Sherry. Got Addie. Nikki.
Great. Okay.
Sounds like.
I'll take that as close to consensus as we'll get based on on the number of committee members that are still present and it being the first Monday of the new year. And so appreciate that suggestion, Christine, and appreciate the questions and the feedback and the confirmation from the committee. What we'll do is we'll put that together and send it out before the next meeting. And then we'll set aside some agenda time for the February meeting to kind of go over and summarize those specific aspects. Michelle, is there anything else about that that we wanted to touch on, or were you done with your presentation?
Yeah, that was the final slide.
Okay.
Yeah.
Okay, great. That felt a little like pulling teeth, but I'm glad we got somewhere. So thank you so much for that input, and I like the next steps that we arrived at. So appreciate the committee's involvement with that. All right, let's pull up the agenda.
We have Brianna next. Then.
Okay, great. Thank you. Thanks. We don't have to pull up the agenda then. That's the last one.
All good. RNP Data Work Group, Progress and Challenges. Brianna, you with us?
I am here.
All right. Take it away, please.
Okay. I think Rachel has my slides.
And Brianna, if you can introduce yourself just in case there's some new people that haven't had an opportunity to meet you.
Yeah, so my name is Brianna Peterson. I am my title is the Technical Plan Developer and Report Administrator for 5476. I support and draft the legislative reports that come out of 5476, 5536, and others throughout, the adult SUD world. I help support. In this context, I provide data and reporting support for RNP data. And so I've been supporting Ryan Keith, the RNP administrator with the adult SUD team. And today I'll just be talking about, typically what I would be doing is I will be going over the quarterly reports of data. Hopefully this will provide some context why we're not presenting that here today. We will be presenting at the next meeting, I believe. But so I wanted to take some time today to kind of discuss some of the things that are coming down the line for Recovery Navigator program. And so today's presentation will focus on recent improvements to how the program collects and reports statewide information. This is not a technical training by any means. We won't walk through any of like the data entry like mechanics. Instead, the goal is to explain why these updates were made, how were they informed, and why they matter to communities and hopefully policymakers. These changes reflect ongoing collaboration with providers, our community partners, and internal teams, and are part of a broader effort to strengthen transparency, consistency, and outcome reporting across Washington. And so, if you're not familiar with Recovery Navigator program, it's a statewide program and serves individuals who use drugs, who have substance use disorders, or co-occurring disorders. The programs are community-based, peer-led, and centered around living experience, and staffing to provide system navigation to treatment and supportive services using harm reduction and peer-supported guidance. These programs, though they follow the lead model, they are flexible and responsive to local needs. Due to these kind of varying ways that these programs run out of their counties, all 39 of them, it's important that we share a way of understanding and reporting about what's happening statewide. This shared data allows us to answer important questions like who is being served, what services are provided, and what outcomes are being achieved. Go to the next slide. So these updates are the result of ongoing data and process improvements. We do have an internal data work group comprised of subject matter experts in this field. Other related programs are data folks and even other data related subject matter experts in social services. We meet regularly every other week, and what we do is we discuss and we go through the feedback gathered from providers, community partners, including the Behavioral Health Administrative Service Organizations, Lead Support Bureau, and our providers. We conduct the process improvement efforts, including data modeling, research and analysis, among various other community programs, and contracting for review and analysis with RDA, with DSHS. So one of the biggest things that we're working through is that the earlier versions of this workbook did not include supporting guidance, which led to variations in interpretation of the items to select, how to use this tool, the workbook. And these updates that we're making reflect collaboration, our testing, and lessons learned over time. And as if anybody's been here from the beginning with Recovery Navigator program, you know that we kind of were building the plane while flying. And so, there wasn't really much time to even look at or consider these things as we were going through. So now we're kind of going back, reflecting, and taking the time to really think about and be really thoughtful about how we approach our data collection. Go to the next slide. So just an overview of some of the changes that are being made. There's now a clear distinction between outreach, referrals, and ongoing navigation or case management. We improved tracking of clients' progress over time, sharing definitions across programs, and streamlining reporting. These improvements are supported by structured data fields through technical mechanics and are addressed through provider training rather than in this type of setting. But we are looking at streamlining this reporting, not only with this update to our workbook, but we all are also transitioning to PDAMs. I think there was a presentation probably a bit ago about our transition into a more data validation tool for collecting RNP data. It's still about a year out from implementation, but we are making progress towards that. BHASOs and providers are aware and have met with our internal work groups, so we are just slowly making progress towards that goal. Next slide. So as I just stated, now that there is a clear distinction because we separated referrals from outreach, we updated drop-down items. We removed ones that weren't really being used, and we included some that more aligned with what the providers are experiencing in real time in the field. We updated case management with an added navigation status column and a drop-down with items to select. We also updated term definitions to include definitions for columns to, again, create consistency across the board. You go next slide. So some of the items that we did remove were the source of income through all now 3 tabs. We removed this, it was like a section 1.3M language. This was in the columns. Providers will notice, will be familiar with this, but this was language that was included in the workbook that actually came out of, or I guess was entered into the workbook based off of the original Blake bill, the Senate Bill 5476, in the change in, what is it, RCW chapter 71.24, section 1, 3M talked about the plan recommendations, but for some reason we included this in here just because it talked about when in regards to collecting and reporting of data that we do identify geographic areas, race, ethnicity, gender, age, sexual orientation, on and on. And so we now just remove that piece of language. We're just collecting that data. There's no reasoning more behind it. So we did remove that. We obviously removed outreach information from the referral section, as there are now 2 distinct areas. And we did remove multiple services provided option. I know this probably came up about 2 years ago in this group because that was an option that was selected more often than not. And so we are now removing that, and with the added drop downs, we're hoping to better align with the services that are being provided. We're also adding an additional column, so those who cannot, multi-select to select all the services that were being provided, they can now select the top 2 services that were being provided at that time. And they're also able to provide notes of any additional services that they were providing that individual at that connection. We removed contingency management from our data collection through some surveying and discussions with BHASOs and providers. It was kind of a toss-up of if it was using in the more therapeutic sense, and so we made the decision to just remove it entirely. And if monetary attachment was, if monetary incentives were provided, they can just indicate that as so instead of calling it contingency management. Go next slide. Yes, you can get a copy of this presentation. So programs can now more clearly report outcomes such as engagement in treatment, progress towards stable housing, transition to other supports or other programs, or continued case management, continued navigation as needed. These clearer outcomes reporting strengthens accountability and supports informed decision making for us as we move forward in this program. And so that's where that navigation status there'll be the updated drop downs. You can go to the next slide. The next slide. Oh, sorry. Yes. These updates were designed to reflect how work occurs in real time. This new guidance supports consistent interpretation statewide. Along with the updated workbook, we are providing supportive tools such as a data definitions field guide, again, defining all the terms so that we are consistent across the state of how we are defining and utilizing either drop downs or how we're, informing the columns that we're requesting data for. There also will be a desk manual for the workbook use that will kind of give like a step-by-step of going through and how to enter in and how to use the workbooks. This should hopefully create more consistency across all the regions, as well as if there's any turnover, that they all have documentation and definitions for individuals to use in case they need them. And so these will be made public. They will be on our website and readily available to all the BHSOs and providers, along with anybody who's interested in looking at it. Can go to the next slide. So why this matters. Our improved data quality strengthens our public reporting here for SURSAC, our program oversight, and creates just consistent data statewide. Again, we're trying to do as much collaboration with other programs in this realm and other programs that are related to or in the same field, so that we can kind of have consistency just across the state when we're looking at our programs. These updates demonstrate a commitment to continuous improvement, collaboration with communities and providers, and provide a clear and more reliable reporting on program data and outcomes. The next slide, yeah. So statewide provider training will take place on January 13th for BHSOs and RNP providers. There's additional times where I will be meeting with BHSOs and providers who are not able to attend or who want additional training after that point. This training will focus on obviously the overview of the workbook changes, the purpose of the updates, how those outcomes are captured, and how to use the supportive guidance materials. The implementation of the new workbook will start Q2 2026. So that invitation is your normal the BHASO meeting, the RNP monthly coordination meeting. That's when that will occur. Yep. And again, I know others have reached out because they want additional support, so I am here to provide that support. Provide that individual training if you guys need it or want it. And again, we will start the implementation of the new workbook starting Q2, April 1, 2026. And so we will start seeing that data when we start reporting out towards the end of the year. And that is me. Is there any questions, comments, concerns? Did the 8-second rule? No, thank you all. Thank you everybody for allowing me to talk today and giving me the time. Yeah, and I will be back with quarterly reports. Thank you.
All right, thank you, Brianna. Appreciate that update. Tony, any comments before we move on to public comment?
No, just thanks, Blake. Thanks so much, Brianna, for that overview. Can you, do we have a timeline for when we'll be back to the committee with the quarterly data reports?
So I'm assuming that I'm on the agenda for February. But if not, maybe March. And I should be back with those quarterly reports. Again, our process improvement include updates to how we review and clean our data internally. And so, that process has taken time, working with multiple partners to get that process going. And so it's just a little bit delayed. And so that's why I didn't have that information here today. So I apologize. But hopefully in the next time, you guys have some time for me and I can come and talk about quarterly reports.
Great. So just flagging that for the committee that either the February or March meeting will circle back around to the regular quarterly data reports, which indicate, numbers served and some of the demographic breakdown that we've been kind of visiting consistently for the past couple of years. And so, and in the meantime, Brianna and the internal team will continue to support implementation of this new version of the data collection workbook and appreciate all of the everyone that's been working on that and all of our state partners as well. Okay, so hey, we're a little ahead of schedule, which is rare, and I don't think it's ever happened. So we have plenty of time for public comments, committee feedback. If there's anything, we've had a couple of different conversations throughout this meeting. So if anything's kind of come to mind from the committee members, I forget how we have it structured on the agenda, so I'm just going to look at it real quick. It looks like we do have it just structured as public comments, but I would include the committee members within that as well. But so let's pause for a second and just see if any hands get raised or questions get dropped in the chat.
So we're taking public comments, committee announcements, anything else? Questions or comments? Go ahead and raise your hand virtually if you want to do any of that. All right, last call for public comment, announcements from committee members. All right, Tony, I see no hands.
Thanks, Blake. So I don't know if we have a draft February agenda to review.
I could pull up the agenda planning document. If we want to look at that, or just give me a moment. I can pull up what we have for February.
Yeah, just wanted to kind of look towards February and just see if we had anything slated for the committee for that particular meeting. We now have a new agenda item to add to it, which will be a summary of which aspects of the substance use recovery services plan are still outstanding or haven't been implemented due to policy barriers or funding barriers. So that's definitely something that we'll be covering next week. And then if we are able to get the RNP data reports updated and cleaned and all of the background work that goes into creating those in time, we'll try to bring an RNP data update to the committee as well. And I thought we had something related to the plan, an update on the plan.
Opioid treatment program expansion update.
That's it. Opioid treatment program expansion update with our state opioid treatment authority, Jessica Bloss and team. This was, directly tied to the plan. I think that the committee had acknowledged the fact that methadone treatment and access to methadone medication at opioid treatment programs was essential to ensuring a full continuum of medication options across the state, and there was funding that was in 5536 that helps support expansion of opioid treatment programs, both fixed sites as well as mobile options. And so next month we are pleased to welcome, I'm not sure who the presenter is yet, but somebody from our State Opioid Treatment Authority office that's going to summarize a lot of the work that's been happening to ensure access to methadone across Washington State. Such important, a huge important piece of helping support individuals with fentanyl use disorder and opioid use disorder. And so looking forward to that update along with the other items that I summarized. With that, I don't remember a meeting that we ended 30 minutes early ever. And so that's my gift to everyone for 2026, 30 minutes of your time to do something and to help support the beginning of the week and help you get caught up on something or go for a walk. It's sunny and blue skies here in Olympia. And so hopefully it's like that in other areas. As a reminder, we do hold this space as part of our alignment with the Open Public Meeting Act here at Cherry Street Plaza at 626 8th Avenue Southeast. Everyone is welcome to join us in person. We usually have a small group here from HCA and Department of Health, and so it would be great to meet others in person as well. And so please always feel free to join us here at Cherry Street Plaza in Olympia. And just looking forward to another year of talking about these important topics and communicating with the committee, collaborating with others, and having important conversations as we continue to help to support expansion of services for this incredibly important piece of the population. So with that, Happy New Year 2026. We had 2025 was very difficult. There was a lot of challenges. So looking forward to continuing to work together to overcome those going into the new year, and appreciate everyone that shows up at this meeting and for your questions, your participation, and your time. So with that, we'll go ahead and sign off, and we'll see you in February.
Thank you.